I'm Robert Bergerman, MD. I'm a neurologist specializing in the treatment of epilepsy, and I'm the medical director of the Sutter Neuroscience Institute Comprehensive Epilepsy Program and the Sacramento Comprehensive Epilepsy Program. If a person thinks that they've had a seizure, at some point in their evaluation process, they need to be seen by a neurologist. But once the initial evaluation is complete, a fairly large number can return to the care of their primary doctor. A certain percentage whose seizures aren't immediately controlled need to continue on with the neurologist, and if the seizures remain uncontrolled after several medication trials, they probably should be referred to a comprehensive epilepsy program. There are certain types of seizures that don't cause any impairment of awareness. If these are happening infrequently, whether it's worth taking a medication every day to prevent them is debatable. Some physicians feel that all seizures should be treated because the condition could worsen and more dramatic or more debilitating seizures could evolve. But the best evidence we have now is that being on the medications that suppress the seizures won't prevent the evolution of the condition. Do epilepsy medications cause side effects? Yes, unfortunately, because of the way that they work, they have a tendency to cause a number of side effects. The way they work is they get in and they alter brain chemistry in a way that suppresses seizures. They alter the balance between excitation and inhibition within the central nervous system. And because of that, they can have unintended effects. And if you look at the list of possible side effects for each of the medications, it tends to be the exact same list for each of them. Some of them are more prone to cause one particular group of side effects than another, but for every individual patient, they can react very differently than another in terms of the side effects they might experience. Some patients do very well and have very few side effects. Other patients find it almost impossible to find a single medication they can tolerate at all. The most common side effects involve sensation, equilibrium, and thinking. Patients can have numbness and tingling. They can have imbalance or dizziness, or they can have memory problems or clouding of thought processes or difficulty with word retrieval. I used to say, this medicine, if you take too much of it, you'll feel like you've had too much to drink and you'll be stumbling around. With this medication, if you take too much of it, you'll feel fine, but you won't be able to walk a straight line. Why are there so many different medications for epilepsy? The reason is that sometimes one medication is completely sufficient to control seizures. When that medication is a failure, I was taught that you switch the patient from that medication to another medication by introducing the new medication, and then once there's been a response, gradually removing the old medication. You can't just switch directly from one to the other. During the transition, you're on two medications. There is another approach that is referred to as rational polypharmacy, where when one medication is a failure, you look at that medication and the mechanism by which it works, and you select a second medication that has a different mechanism for working and add that into the first. How often do medicines solve the problem of seizures? Overall, about 70% of patients, if the doctor does his job in correctly diagnosing the condition as epilepsy and the type of epilepsy the person is suffering from, and chooses a medication that's appropriate to that form of epilepsy, 70% of patients are seizure-free or have very rare non-debilitating seizures. The most important thing in terms of responding well to medication for epilepsy is compliance. And what I mean by that is that it doesn't do any good if you don't take the medication. And studies have shown that somebody who knows that they're being monitored, who's in a study where they know the medicines are being counted and it'll be known whether or not they stuck to the plan in terms of the medication, people can only comply with a once-a-day dosing about 90% of the time. It just seems to defy human nature to expect better compliance than that. When it goes to a twice-a-day medication, the compliance drops down into the 80%. Once you go to 3 or 4 times a day, compliance drops to 60 to 50%. What I tell my patients is it's not so important what time you take your medication in relationship to the other times. In other words, spacing it exactly so many hours apart. It's much more important to take it at a time you'll always remember to take it, even if it throws the number of hours between doses off. There are certain types of epilepsy that respond to only 1 or 2 medications, and when those medications have a short half-life in the blood, that means the medication needs to be given 4 times a day in order to maintain an adequate level. We now have extended release versions of those medications so that the patients only have to take medication twice a day.